So, Dr. Bernad,
Yes.
welcome. Could you briefly introduce yourself?
Yes, I'm Peter Bernad. I'm a neurologist, and I work with AMIQT, American Medical International Quality Training, and our job is to help train various medical students, undergraduates, graduates from all over the world.
And you're also a professor at George Washington?
I am.
Mm-hmm. So, in terms of your own clinical practice, what is your personal ethos in terms of treating your patients?
Well, I like to take care of our patients and like to get to know our patients. We take a very detailed history, and we do the physical exam, and then we have laboratory studies. And generally over the years, we've had some wonderful patients who are very loyal to us. As you saw today, we just finished with this last patient who's been here for 20 years. This is not unusual that we're seeing patients over the years. And they seem to come back. I think they like us.
Mm-hmm. So, as you've been in this medical field for a pretty long time, and so you've noticed the changes in the generation, could you kind of describe the daily battles with, I don't know, the medical healthcare system that you've been kind of seeing and observing throughout?
Yeah, we've had hassles, the hassle factor in medicine that's been increasing over the years, and I think that's been the most destructive part of being a doctor. The amount of problems that we deal with outside of patient care, and that seems to have increased and is increasing every year. We try to overcome that and maintain our love of medicine and our desire to serve the community and serve our patients the best way we can. And I think that has sustained us. The negative, the hassle, the government intrusions, the agencies, the lawyers, the paperwork, the bureaucracy, they all attempt to diminish what we do, but the care of the patient and the love of the patient towards the doctor basically sustains us. And it's a constant battle of survival. But fortunately, I see the young doctors, they still have the ambition, and they have the vision, and they have the love of caring for fellow human beings. And that has never diminished, and that seems to be ongoing, and it was present thousands of years ago, and it's still present.
Mm-hmm. And so, as a closing remark, could you kind of give us sort of an advice for the young doctors entering this field of medicine?
Well, the advice I have is the advice that I've had all along, is do your best, study hard, but always remember that you have to be happy in what you're doing. You try to fulfill your own needs and your own desires together with helping the patients. And ultimately, it'll work out. Some days you may feel overwhelmed. Some days we have horrible things happening in terms of the paperwork, in terms of agencies, governments, lawyers, and so forth. But the important thing is to keep your eye on the prize, which is to take care of patients. And the patients give us hope. And when you see joy, and when you see in the patient's eye the sincerity and the care and the thank yous, you go home at night and you say it's all worth it, and you're ready for the next day. At the end of the day, it's very important to have peace of mind, so that when you go to bed, you recognize that you've done your best and you've tried to help a fellow human being. There is no greater good than to see the joy in a fellow human being's eyes, and to see the joy in the family when you helped an individual.
Wow, thank you so much.
Thank you very much.